Good morning, everyone. Thank you for coming. Though I notice it's mainly health-related people who have come, and that's good because at least we'll know what each of us is trying to do. So this is a presentation on an initiative our team is taking. We are attempting to create, as you can see, a affordable, effective, and integrative healthcare and research service in Auroville. And the umbrella under which this is being done, we have chosen to call the Auroville Institute for Integral Health. I think most of you know about it. And let's go forward. So one of the first questions actually is, what is health? And there are many ways of looking at health, but from an integrative approach and also adopted by World Health Organization, is that it's of complete physical, mental, and social well-being. And I think most of us would say we add spiritual well-being to it too. So it suggests a state of well-being of the whole person at all levels, and not merely being okay when they wake up in the morning or go to sleep in the evening. However, we do know from personal experience and that of friends and relatives that very few people are really healthy for any degree of time, and that when we end up going to a hospital, which has become the routine in recent years, there is a bewilderment and a bit feeling of being lost in that big hospital where everyone looks at you and says there is this, and various people have contradictory opinions. Plus, things are very expensive and complex. At the same time, we know that Ayurvedic practice in India and the local village practice, etc., are falling out of repute since colonization of India, and they are not used that much. And even where people work together in a traditional alternative way, they are lacking a model by which to share their information. Now, there are various perspectives or ways of looking at health at a larger angle. One from Kel Wilber, which is quite broad, not only looks at the person in the center, but also thinks of it as what is their inner experience, what are their actions, what is happening in the world around them, and what is the state of the world. So a way of looking at health not only as an individual, but an individual in society. There is, of course, the traditional Indian yogic approach, which looks at man in terms of the 7 bodies, including the physical, the energetic, the emotional, the mental, the spiritual, and the causal, linked to the chakras. And then Chinese medicine brings in the meridian system, which distributes energy through various organs of the body. Also, we have a perspective given to us by Sri Aurobindo Mother, of which I like this one quote, in which all illnesses and disease, we can say, are falsehoods, because the natural state of the body that it's meant to be is of complete well-being. And that if the God touch is there, all can be done. So no matter how difficult it looks or how complex the situation, it can be done if we are surrendered and open to a higher agency. So our approach is based on an integrative practice. We don't call it an integral practice as yet, because to be integral, you must know all the parts and be able to put them together coherently and be very effective. So our approach is integrative because we are starting out bringing together various systems to provide care which treats the patient as a whole. So we're integrative, but we are not sure we'll have a completely integral result in each and every case. An integral result means the complete restoration of well-being at all levels in the person. So we are able to combine in this approach various diagnostic and treatment strengths. Also, we focus on enhancing health, preventing disease, and treating the patient with 3 criteria: safely, effectively, and at a minimum cost. All very important in my opinion. And also to look, of course, as the patient as a whole. So we have identified 3 pillars which we will hold to in our practice. One is that the patient care, that which goes directly to the individual patient, must be integrative, which requires a team of practitioners from various disciplines, including Western medicine, alternative systems, traditional systems,